Thank you, Mr. Chairman. I want to thank the witnesses for their tremendous work and testimony so far in today's hearing. I wanted to touch on a couple of areas that I don't think have been touched on already. First question is for Mr. Mim. In the GAO report titled Census Bureau Needs to Assess Data Quality Concerns Stemming from the Recent Design Changes that was published in December of 2020, it was mentioned that to save costs, the Bureau increased its reliance on solely using administrative records to count non-responsive households. One of the examples constantly pointed to is including Medicare enrollment data, as well as individual tax return data to improve the count. The report highlights some issues regarding the use of tax data. For example, individuals not having enough income to have to file tax returns or not listing dependents for tax purposes. However, I'm also concerned with the reliance of other public benefits data. Soon after taking office, former President Trump announced that he would be expanding the definition of public charge, which meant that whether an immigrant uses public benefits such as housing assistance, SNAP, Medicaid, that it could be considered a negative factor in a green card application. So as a result of the public charge rule change, many immigrants disenrolled from benefits that they were eligible for or did not enroll in benefits for which their U.S. citizen children were eligible. So, Mr. Mim, can you take a minute just to discuss how the public charge rule and using administrative data to count non-responsive households might lead to inaccuracies?
Yes, thank you, Senator. We haven't looked specifically at the public charge issue, but the larger thesis behind your question is exactly right, and that is that to the extent that residents are not captured in administrative data, I mean, the truism is, therefore, that administrative record would not be useful for helping to enumerate their household. And in fact, what we also know is that the administrative records are most valuable for some of these hard to count populations, some of the last few percentage of the population that either didn't respond on their own or didn't respond to a census taker when they went and knocked on the door. That's why some of the records that they use are exactly what you were saying: the SNAP, the WIC, the Medicaid records. So again, to the extent that someone's not in the system, the records will not be useful in terms of enumerating them, and you therefore increase the risk that they will be missed.
Okay. Thank you. More to follow up on that, but for another topic that I believe is timely, this is for Dr. Jarman. A program called the Count Question Resolution gives state, local, and tribal governments an opportunity to challenge their census results and seek revised counts for purposes other than redistricting and other than apportionment. However, those challenges must be based on a very limited set of criteria involving geographic or processing mistakes affecting living quarters. And I think we've already discussed in this hearing the dynamic of living quarters, housing units, group facilities, et cetera. So in light of the many challenges to conducting a complete and accurate census last year, will the Census Bureau consider expanding the scope of the Count Question Resolution Program to allow challenges based on a broader set of outcomes that indicate significant miscounts or undercounts in a jurisdiction?
So, Senator, I'm not familiar with any discussions to broaden those definitions, but we would certainly be willing to take a look at that and get the folks on my team that are responsible for that and talking to you or your staff or to whomever. But I at this time, I'm not aware of any of those discussions right now.
Okay, well then consider this a request for consideration, and we'll have through our staffs follow up to see how that can be explored. The next decennial census is only 9 years away, so we're already starting to work on that. And with that, Mr. Chairman, I yield the balance of my time.